That is the title of my presentation. Welcome. I am coming to you from Southern California, and I am an owner and a partner in an interdisciplinary private practice setting called Sunflower Therapies. I'm in private practice in partnership with my mom. She's a speech and language pathologist, and together we have many, many years of experience. You can find my contact information below and also our website. So without further ado, we will get into it. So in this webinar, you will learn a brief overview of the following objectives. The questions are, what is compassion fatigue and burnout? We will answer those questions. What are common signs of compassion fatigue and burnout in healthcare settings? And what are some ways for healthcare workers to engage in self-care practices? So the question is, have you ever heard the expression, you can't pour from an empty cup? I'm sure that you have. So I want you to take just a few minutes and think about what this expression means to you. Does it carry a certain significance? To me, a lot of people say that practicing self-care is selfish, right? But what I say to them, especially because that's why a lot of people come to me in private practice, is that they feel depleted. They feel like they're, burning the candle at both ends. They feel like they just are burning a lot of fuel and, running on fumes a lot of times. So it's very difficult, whether you think of the analogy of the cup or, the gas tank is another one of my favorite metaphors, where obviously if you're driving somewhere and you don't have a ton of gas, you're not going to get very far. So in order to fuel your own tank or your pour, from your cup, you have to have some kind of substance in there, and be mindful as well as maybe when it's getting lower, or maybe when it's becoming a bit dire. We feel that in our wallets too, like with money, finances. If we have enough to go around, then that's fine. But then when it comes down to like the last few dollars, it doesn't feel as good. It feels like we might be missing something. We're kind of scraping the bottom of the barrel. It's hard to go on. So in essence, we need to, as healthcare practitioners, just be mindful of how much we are outputting and how much we are taking in. So I'll get to that in a little bit, but I just wanted to put that out there to kind of have you reflect on what this means to you, and maybe keep that in the back of your mind as we go through the rest of the. So did you know that healthcare work is one of the most demanding professions? And this can ultimately lead to burnout if the provider doesn't monitor their own well-being. So again, going back to the awareness piece, we really need to be mindful of how we're doing. What may be doable for someone else may not be doable for us. And, we kind of go through different points in our lives, and we may not always be able or, willing to give as much as the next person. And I think a lot of people can get into the comparison trap, where they go, oh, well, that person is working double shifts, or they're working more than me. Why am I not doing that? And so, the other person may not have, maybe that you have a young family with young children, and they don't. So they're able to pull a lot more shifts than you, or you might have a difficulty in your own life that's preventing you from working as many hours as you used to, or whatever the case may be. It's difficult to say. So in terms of what is compassion fatigue in healthcare settings, this has been defined by Zhang and colleagues as the progressive and cumulative outcome of prolonged, continuous, and intense contact with patients, self-utilization, and exposure to multi-dimensional stress, leading to a compassion discomfort that exceeds nurses' endurance levels. And this is a state where the compassionate energy of expends beyond restoration, causing marked physical, social, emotional, spiritual, and intellectual changes in a progressive manner. So ultimately, I like this definition, but it's also pretty verbose in the sense that it does, compassion fatigue can affect and does affect all aspects of a provider's life. And there are many facets that can pull us away from being able to show compassion and show empathy towards our patients, because that just, pulls away from that resource, our ability to be present with other people over time. Again, if we're not careful, I would say, if we overdo it continuously. And another metaphor is like, if you are into exercising and you continuously go to the gym and never take a rest day, never take any time off, what's going to happen. You might injure yourself, you might pull a muscle, you may not be able to be at your peak, and because your output is not balanced with the input that you're putting in. So that's the same thing with compassion fatigue, is that there's an imbalance here of effort being expelled versus effort being invested. So that's where you can result in having compassion. And so burnout then in healthcare settings is an occupational definition that Zhang and colleagues talk about as a term used to describe workers' negative behaviors and attitudes towards work in response to job strain, with feelings of frustration, powerlessness, and inability to meet work goals. So if we think about compassion fatigue as being more individualized for each person, and burnout as a term that is coined more towards that occupational stress, it's a good way to be able to differentiate between the two. So in healthcare settings in particular, compassion fatigue and burnout can lead to, and this is drawn from, again, Zhang and colleagues, a negative impact on the nurse's overall well-being. That could be physical, emotional, spiritual, any combination of all of the aforementioned facets of life satisfaction. They talk about lower sense of job satisfaction, not being inspired or compelled, motivated to continue working, or just not being willing then, or decreased willingness to remain in their profession of healthcare. It also, on the patient side, can affect how patients come out of their particular condition, and also their viewpoint about healthcare. And you can find that they are dissatisfied with the level of care that they have received, for example, because it's going to be difficult if you're in a state of progressive compassion fatigue or burnout to, again, show empathy, to show that you care, to show that you want to be at work. All of those facets may not be present if the principles of burnout and or fatigue are. So what are some of the common signs of compassion fatigue and burnout in healthcare settings? This is according to Peters, and also just what people have reported to me, and what I have also read about, but it's very well summarized by Peters. You have emotional and physical exhaustion. You can have that. You can have fluctuations in weight, poor judgment. That can be occupational and or personal. Because of the poor judgment, you have a propensity to an increase in work-related errors and or accidents. So you can see how this would also go beyond the individual being affected, and now the workplace is affected. The team is going to be likely affected. So workplaces really need to pay attention to some of these signs, because ultimately it does affect not only the morale, the culture, their bottom line, and patient satisfaction. Because why are we here? Why are we doing what we're doing? Yes, we get satisfaction from helping others ideally, but ultimately it is up to patient progress and patient outcomes. So you can have increased absenteeism, or just a phenomenon of absenteeism altogether. So providers not showing up for work. You can have the propensity to abuse alcohol and or other substances as well. You can be at risk for a decline in your ability to remain empathic. You can also have the increased levels of feeling hopeless and helpless about what's going on, about the future, which can then also have influence from questioning one's values. What is this about? What am I doing here? What's the meaning of being here? And also just overall feeling like you want to leave the profession altogether. So how do you approach practicing self-care as a healthcare practitioner? What I say about self-care, because in my practice I see a lot of people, particularly women, who are experiencing anxiety and stress, and like oftentimes an imbalance between their responsibilities and the need to take care of themselves. So this is something that I have come up with as far as self-care being a posture, rather than a to-do list. Because what you see a lot of times in the modern psychology or the popular psychology is this big list of items to check off. Like, okay, I wake up, I journal in my journal about my gratitude, and then I indulge myself by using my favorite shower products in the morning, or I go exercise. So it just becomes this, never ending list of like, did I do this? Yes or no? And we have enough tasks on our plate. So we don't want to approach self-care in the same way as we would a task list. Rather, thinking about self-care practices, how they can enrich our everyday lives, and integrating those practices in our philosophy of how we want to live. So it doesn't have to be this checklist. Rather, it can be, taking a different way to and from work. It can be taking a 5-minute break and practicing mindfulness between tasks, or right after work, between work and the next place, whether it's, you're going to exercise or catch up with friends, or, you're turning off for the day. Then having space between those activities so that you're able to practice, shutting off the work mode and going into your own mode, because a lot of times those roles can really get blurry if we're not mindful about those transitions in our own lives. Authors definitely recommend exercising, moving. It doesn't have to be any one particular type of exercise, but certainly getting the blood flowing, getting, fresh oxygen. Um, and most healthcare practitioners know this. It's just a matter of implementing what is helpful. So, and I see that a lot too with, because we're told the same thing as therapists, like can be a very sedentary position. I know a lot of nurses are running around. So, in our profession, especially though, because we are so sedentary, sometimes, you just don't feel like exercising. But even doing a little bit, whether it's like stretching or some restorative yoga, like that can definitely count too, just something to move the body. Same thing with proper nutrition, restful sleep, um, making sure that we're recharging ourselves and nourishing ourselves, fueling ourselves for success, for wellness, is important. Also, as much as we can, taking our breaks as scheduled, being mindful of um, not working through our lunch break, or going so many hours without drinking or eating, like, because number one, that's not really the best for us, and number two, that's also very counterintuitive, right? Because we're telling people make sure to stay hydrated, and then we're not doing it ourselves. So we want to be the models for what we're telling people to do. Um, and that just goes a long way with with patience, with trust too, right? In addition to being good for ourselves. So making sure, again, that we're taking advantage of our breaks, that we're taking advantage of any vacation days that we have, holidays, to recharge, to step away, even though it might be difficult mentally to do that. And, in psychology, there's been research done on motivation, and it suggests that we're actually more productive not when we're trying to multitask, which is contrary to popular belief that we have to do 5,000 things because we have the technology to do it. Doesn't mean that we should. And it doesn't mean that we get enough done, because actually the research suggests the opposite, where if you focus on one task at a time, and even forcing yourself to not do very much one day, that the following day you're going to be that much more productive. And personally, I have taken that into practice, and I can attest to the fact that it does work, even though my personality type is a type where I want to get things done. I have to be that much more forceful with myself about, reminding myself that I don't need to do so much all at the same time, because it's not gonna work. um, and also, if we need to, like, it's okay, to reach out to a professional. I know nurses and healthcare practitioners are professionals, but there are times where maybe we need more support, and that's okay. It's okay to access support, whether it's from employee assistance programs or other mental health services. Um, Sometimes just talking to someone that doesn't have an idea about your day to day and that can give you a fresh perspective can be really helpful. Um, and again, this sounds really simple, but in action, focusing on the positive, um, and just shifting our mindset to that, because it's all about perception at the end of the day. We can dwell on things that are um, dark and negative and critical, and kind of stay in that space. Or we can also, at the same time, choose how long we want to dwell on that, and then just make the decision that we're going to frame this as, like, let's say, a learning experience or something more positive, in order to help us progress and move on, and, have that mindset shift. Also, it's important to take time to practice hobbies or other interests outside of our profession, um, so that we have some kind of balance going on. Um, Even though, we love our profession, like in counseling, for example, the latest statistics about retention and how long people stay in the field is 7 years. So that's really not a lot considering how long it takes you to become a counselor. So with that in mind, we're in it for the long haul, ideally. You did not study so hard and do all this training and do all these hours and work so diligently, to just stop in a few years from now. We're in a marathon. It's not a sprint. So for that reason, it's important to take time out and explore life. So, that can also help us when we're going through a more difficult time, to think about some of the other times that we've had outside of our profession, to disconnect and reconnect with people who are important to us, and hobbies and interests that are important to us as well. So here are some mental health resources for nursing professionals. There is the American Nurses Association, Psychiatric Nurses Association, the National Suicide Prevention Line, and that's the SMSHA National Helpline for Treatment and Referral. All of those are really great resources just to have. So those are up for you. And then on the next page is just my references. So here are some selected references. Thank you very much for your time and attention. Please let me know if you have any questions or additional feedback. And I really, really appreciate the time and your participation today. Thank you.